You are most welcome. Today we will talk about resuscitation. Resuscitation: when a casualty has no pulse and is not breathing, you must combine artificial ventilation with chest compression. This is a sequence known as cardiopulmonary resuscitation (CPR).
Cardiopulmonary resuscitation has two components. 1. Artificial ventilation. 2. Chest compression. 1. Artificial ventilation. Expired air still contains 16% oxygen, so you can use it to breathe for a casualty by blowing it into his or her lungs. If a casualty has stopped breathing but still has a pulse, give 10 breaths of artificial ventilation. Then continue at a rate of 10 breaths per minute until the casualty starts to breathe on his or her own, or until help arrives. Check for a pulse after every 10 breaths. Mouth-to-mouth ventilation. 1. With the casualty lying flat on his back, first remove any obvious obstruction, including broken or displaced dentures from the mouth. 2. Open the airway by tilting the head and lifting the chin. 3. Close the casualty's nose by pricking it with your index finger and thumb. Take a full breath, and place your lips around his mouth, making a good seal. 4. Blow into the casualty's mouth until you see the chest rise. Make about 2 seconds for full inflation. 5. Remove your lips and allow the chest to fall fully. Deliver subsequent breaths in the same manner. 2. Chest compression. If there is no pulse, the stopped you will have to provide an artificial circulation by performing chest compressions, which will send blood to the brain. To be of any use to the brain, this supply or heart has blood must be oxygenated, therefore chest compression must be combined with artificial respiration. 1. With the casualty lying flat on his back on a firm surface, kneel beside him and feel one of his lowest ribs using your index and middle fingers. Slide your fingers upwards to the point in the middle where the rib margins meet at the breastbone. Place your middle finger over this point and your index finger on the breastbone above. 2. Place the heel of your other hand on the heart bone and slide it until it reaches your index finger. This is the point at which you will apply pressure. 3. Place the heel of your first hand on top of the other hand and interlock the fingers. 4. Leaning well over the casualty, with your aim straight, press down vertically on the breastbone to depress it approximately 4 to 5 cm, then release the pressure without removing your hands. 5. Repeat the compressions, aiming for a rate of approximately 80 per minute. Having known two basic concepts, the sequence of CPR is: 1. Immediately dial for an ambulance. 2. Open the casualty's airway by tilting the head and lifting the chin and give 2 breaths of artificial ventilation. 3. Move your hands to the casualty's chest, and give 15 chest compressions. 4. Return to the head and give 2 more ventilations. 5. Give 15 further compressions. 6. Continue to give 2 ventilations every 15 compressions until professional help arrives. With 2 first aiders, one gives chest compressions, the other can give 1 breath of artificial ventilation after every 5 compressions. Pause to ensure that the casualty's chest rises, but do not wait for the chest to fall before continuing with chest compression.